The scenario will be, you arrive on scene for how old are you?
22.
22-year-old male who fell off the first floor balcony of his apartment onto a concrete surface.
And just happened to land perfectly like that.
Yep, landed on his back. He's complaining of head pain and lower left leg pain.
Do you want me to actually put gloves on?
No, I'll walk you through it. So you take your BSI, so hold your hands up. Then you determine if the scene is safe and determine mechanism of injury and nature of illness. So go down and talk to him and ask him what happened.
Hi, my name is Jessica, LTC ambulance. Can you tell me what happened today?
Okay, there's one patient. He tells you that he's got the head pain and the leg pain. You think about additional help, and you're gonna go hold C-spine, and then I'll let you take it off. So you can secure C-spine, but now you're gonna let go of it because your partner's gonna take over for you. You talk to him, you get back down and talk with him. He's told you the chief complaint. You can open the airway. Show opening the airway with the jaw thrust. You can assess for breathing now and adequate ventilation, so you can take your stethoscope and just listen real quick. All you're doing is listening to lung sounds on each side once really quick. And then they can apply oxygen, and you're gonna start directing your partners to get the oxygen ready. So next thing you're gonna do is feel for a radial pulse. And then kind of over-exaggerate, feeling skin color and temperature. Then you're gonna look for any major bleeding, so just look up and down the body for any major bleeding. Then you're gonna think about your transport position or decision. And now you can just do a very rapid trauma exam, starting at the head. Just go from the head, neck, when you get to the chest, kind of grab his rib cage on each side and have him take a deep breath in. Okay, then do the 4 quadrants of the belly. Pelvis. Okay, go down each leg real quick. Have him move his foot. Okay, go to each arm. Have him squeeze your hand. Okay. Now next we would think about our transport decision. If this is a load and go, we would load and go with him. After taking care of any life-threatening injuries here, we would take care of his fractured leg and bandage his head inside the ambulance. So once in the ambulance, we would take vital signs. So go and put the blood pressure cuff on. Get the stethoscope and actually take the blood pressure. Just pump it up and let it out real quick. You don't have to do anything. Don't put your thumb over the end of the bell though. Carry blows here. Then take his pulse rate. Okay, you got it. Then listen to his lung sounds.
Do you want me to
You can check his pupils real quick. Okay, now we'll do a detailed physical exam real quick. So start at the head. And the scalp again. Have him open his mouth. Kind of exaggerate, looking at for tracheal deviation. we're gonna check the eyes. Now you're gonna look at the chest again.
Try to pretend like I'm exposing.
Yep, pretend like you're exposing, yep. Then feel the chest. Have them take the deep breath in again. Okay, the belly again.
Should we pretend like we're cutting his pants off?
You can. Once again, checking for CMS, each extremity. Then you do the upper extremities. Check for a pulse, have them squeeze your hand and move his fingers. And then, let's do this, take the blood pressure cuff off and we can just roll him onto a side and we can just put it back. Kinda help her a little bit, she's gonna roll you to one side, kinda. And using C-spine, she would roll the person as a unit and then check the back as well. Manage any secondary injuries and wounds and continue to do the ongoing assessment.